about 18 months ago. I was rear-ended by an Uber driver in Los Angeles. He was doing approximately 50 miles an hour. I was doing about 15. I was knocked unconscious. Ambulance transported me to Cedars-Sinai, where I was a staff surgeon up until 3 years ago. Cedars is an epic shot. On the gurney going into the hospital, they wheeled me into one station. I'm sitting like this with my neck traction, with my neck brace on, and I hear questions being fired at me, and they're just, pecking on the keyboard. All that time, my arm's getting more numb. My fingers are getting even progressively more densely numb. I'm an orthopedic surgeon, so I know what that means. My head is ringing like crazy. I then go to the next station. I'm being asked again more questions. A lot of them very similar to what the first one asked. And I said to the person taking the intake, why isn't the data transferred from the next? Ultimately, I wound up in the ER after a wait there. Ultimately, I ended up getting a CT scan of my brain and my cervical spine. I did have a little bleed in my cervical spine canal. They consulted a neurosurgeon, and actually just sent in the images. And actually, I, as a surgeon, I spoke to them myself. At about 4:45 in the morning, they were ready to discharge me, and I was sitting there waiting for them to bring the paperwork and get me out of there. I sat there 2 hours and 45 minutes in the booth waiting for them to bring me paperwork, just simply because they couldn't get a response back from that neurosurgeon who was actually my friend. I tried texting him to call them back and let me go. Ultimately, I got so frustrated, I stood up, walked out with my soft neck brace, said, I'm leaving, give me the paperwork, I'll sign out AMA, and against medical advice, and ironically ended up taking an Uber home. To get home. Yeah. After leaving the hospital, did I get a single follow-up from the emergency room? Zero.
Can I just point out Cedars-Sinai is considered one of the best institutions?
This is one of the top-rated healthcare institutions in the world. Not a single follow-up. My ability to go back in, I'm no longer credentialed there, so I can't access their EPIC system. To get the studies that were done, to actually take it to another surgeon to get an opinion, basically impossible. So from a patient perspective, very few people, I think, are interacting with healthcare and coming away with a satisfactory experience. It's very frustrating. The good news is we're starting basically from a service level that's like 1 to 2 stars if you're going to compare it to a hotel. So you don't have a very high bar to achieve to raise the level of satisfaction, but it really is a problem, and I'm excited for our company to be able to work with yourselves around really trying to improve that patient experience and have the patient actually be a part of their own care versus just feeling like you're a piece of meat transferred from point to point. So that's how I think about patient engagement.
Well, thank you so much for sharing that. I think you also shared just an element of provider engagement too, right? Because the provider was not integrated into the system. You happen to have the guy's phone number, you could start a text stream, but they were not, the system was not. Because I'm sure the doctor would much more prefer to have been communicated to that way at 6 o'clock in the morning.
Yeah, the diagram that was demonstrated where you can actually see the patient in the middle and everybody around, very powerful. And with Tiger Text, we've integrated into some other EHRs that have done precisely that with the long-term care.
Yeah.
And it's extremely powerful.
Yeah. Great. Thank you so much for sharing your story.
So for health-wise, it's real similar to Andrew's story, and I think we've been in situations like this, hopefully not quite that bad, but or we know somebody who has. And I think from our perspective, one of the challenges is oftentimes we talk about patient engagement like it's a magic destination, and we're going to get there someday. And like so many things in healthcare, it's really a process. And I think our belief and approach is around you're going to get engagement when you're capable of building confidence in a patient, because you know how this is for yourself. If you do something and you do it well, you build confidence, and then you start to own that thing in your life. And so that's really what we're trying to do is help people build that confidence and ultimately own their care. And there's a couple of simple approaches that we try to facilitate and that we believe in. One is helping patients do as much for themselves as they can. So 3 hours, maybe less per year, patients spend with their doctors. That leaves a lot. 8,757 hours that they need to care for themselves or care for their families at home. So we try to really empower and get people to do that. And then the next piece is 2 big steps. And it all really goes back to patient preferences and values and making sure that gets communicated back to the care team. So we try to facilitate that in that 2-way communication. One is helping people understand their options so that they can make the decisions that are best for them. And the other is what to say no to. There's a lot of overutilization, and how do we make sure that patients are knowledgeable enough to make good choices about what they don't want done for themselves or their family. And so that's patient engagement in action as a process for us, and that's what we're trying to do with our clients and partners every day. And I think that's one of the biggest promises why we're so excited about working with Rita and Salesforce and HealthWise.
Thank you so much. And I think that there is a lot. So when we just tested, not HealthWise, but we tested sharing of knowledge and information with patients. And they wanted to know if it was from Google. I said, no, well, it's from a trusted source. Well, okay, as long as it's from a trusted source and my physician or my clinician has signed up for it, I will look at it, because there's so much junk on Google. So I think that's another point about HealthWise that I think we need to make, is that it's 40 years of not only amassing this information, but curating this information, having trusted clinicians that are embedded in it. So, again, but putting that power in the hands of the healthcare professional to be, I call it I-prescribing, information prescribing, then you just hand it over to the patient. To me, that's a real key part of patient engagement. So thank you so much. So let's look at next year, HIMSS. So let's say we achieve this vision. We go out to some provider organizations. We now have secure texting. We have education. Maybe we have education being securely texted over to patients. What's going to be our outcome? What are we hoping to get? And maybe you guys have successes that you've already seen in the marketplace. I think everyone would love to hear about that.
Sure. Just to kind of add on what you were talking about, the information that you send to patients, and they ask whether it was Google. It's probably no bigger nightmare as a doctor when the patient comes in with a stack of papers that they printed that they got from a Google search. Right? Yeah. Right. So I think being able to have curated information that really is germane to that particular person is really important. So, we're in a really critical and very interesting time in healthcare right now. We've had 2 sort of major phenomenons occur simultaneously, which has created a very ideal situation to really make change. And from our perspective at Tiger Techs, those 2 things are the massive digitization of healthcare information from paper to electronic, and then the rise of smartphones, where everybody's now walking around with a phone that has more computing power than anything that was used to put the man on the moon in 1967. So these are 2 very, very critical things that allow that massive amount of information to be moved around. So, we, despite what people say, we're number 20 in the world in healthcare. We, Bangladesh is better than America because more people have access, and blah blah blah. We have the best healthcare system in the world. I have no doubt about that. From science, the physicians, we have a tremendous amount to be proud of. We have a lot of money in the system. It's 20% of our gross domestic product, but yet people are unsatisfied. So I believe that a lot of the problem that we are seeing in healthcare regarding the delivery and cost resides around the inefficient way that information is moved around. We have a tremendous amount of information that's siloed between different things, and that actually costs a lot of money. If you just think about my situation, I'm in the ER there waiting for a guy who's not accessible through some sort of digital way, or it's not forwarded on to somebody who could have answered that question. So I languish for almost 3 hours in the ER waiting to be discharged. Well, the cost is the same to the hospital on a per minute basis. However, they could have brought in, if they moved me through in an efficient way, another patient during that time, which ultimately reduces the cost of my particular care. So, going forward, I think the more we make things efficient, the more we involve patients in their own care, they have a question, you leave, you're all discombobbled, and you want to now go back to have it in this kind of electronic form is extremely powerful. And by making things more efficient and move through the system, we will save money. And that is, it seems somewhat nebulous now, but I can tell you from our experience at TigerTex, we now have case after case where we've gone in and benchmarked things for one period of time, installed TigerTex as a workflow tool to improve efficiency. This is around ordering a consult time, lab results, admit discharge workflows. A lot of things have to be coordinated around admitting somebody on the front end, things have to be done discharging. And we have, just countless of examples. Waterbury Hospital admitted one workflow, consults. $250,000 was saved after the implementation of TigerTex, when it was benchmarked before, in reduction of time for a consultant to come and see the patients. $1 million a year on a $30,000 a year customer. So we don't have to do that much in terms of lift to make a massive impact on cost.
Right.
And that's really what I'm excited about, because you guys are breaking down those silos and allowing that varying complex but independently held information to be able to work with, be acted upon, and I think we're really heading into a terrific time for healthcare.
Agreed. Thank you. Jason,
Good.
where are we going to end up?
Yeah, I absolutely agree, and of course we want to contribute to reducing costs. Of course we want to improve patient satisfaction. We want to improve quality. Of course we want to do those things, and we have been a key part of randomized controlled trials that show significant movement, 30% increase in patient activation if you can give them materials that engage them around what's personal to them. And then as they're more activated, they're going to make smarter decisions. They're going to choose oftentimes less aggressive treatment options. That's going to lead to higher quality outcomes, better satisfaction for sure. I think really what it boils down to is it needs to become intensely personal, because it already is. So we just need to recognize that healthcare is intensely personal for all of us. And that's what I love about the way that we can work together in a collaboration platform is, I don't know if you guys can see on the patient card, but we care about the behavior change stage that somebody's in. So we care about, have they just been diagnosed? Great, we've got something different for you. Have you been battling with this for a long time? Do you need some motivation? Great, we've got something intensely different for you, and it's personal to you. So that's where I want to see in a year. I want to see those stories, patient stories, and I want to see that round trip that's happening and how many times people are picking up what their physicians and care teams are giving them. And ultimately, we all know if you're engaging the patient, you're going to get to the triple aim, you're going to get to the outcomes. But I think the tangible baby steps are really, really important. Just get people to engage, build the confidence, create some success experiences, and get them to engage with their care team. So that's what I want to see in a year, is stories like that.
Absolutely, agreed. So I think that's the vision for all of us, right? We want to improve the effectiveness of care. We want to improve patient satisfaction and engagement. And a lot of how Health Cloud does things and how Salesforce does things is we build platforms. That's what we do. Health Cloud is a platform. But we work with our ecosystem of partners to be able to deliver the kind of solutions that the customers need to be able to achieve their goals, whether it's around improving outcomes, reducing costs. That's a big part of our story, is how do we best work and enable the ecosystem. So we were able to show you, and I think honestly the partners didn't have to spend tons and tons of time to get to this place, right? And so we can get this in the hands of lots of people that can really do something with it. So I think we have a little bit of time. If there's any questions in the audience, I'll be happy to answer them. Who wants to ask their first question? Jim.
I have a question. So, Centura Health is a TigerTex customer, but the people that are doing care coordination and nurse triage and engaging the patients are on Salesforce, not the EMR. So, what's the impact of cost structure if they're already a client of TigerTex, be able to bring this tool to Salesforce? cost, or is that something that is part of the overall structure for an organization?
I think that's TBD at this point. But what I will say is that the coordination aspect around care has been woefully inefficient. And one of the things that we really learned at Tiger Text is that after you're in an organization like Centura, we've built out a very substantial post-implementation team to actually be in a more sort of prescriptive, consultative approach to our customers. Because a lot of times our customers who buy the product are really just using a portion of it and really deriving, benefit, but not even close to what they could. So in the case of Centura that's using us, as this kind of starts to progress in a more further way, I can't tell you exactly how the cost structure is going to be because frankly I don't know, but we will be a very integral part of being able to provide that communication backbone and that last mile of being able to tether all of these things together. That all we do at Tiger Text is one thing. We focus on messaging, secure messaging, the most efficient one, data analytics around it, the dashboard, and that's all we do. We have 65 engineers focused on this one thing, and that's it. So I'm very confident that it will get integrated as this rolls out further, and it likely will be a very non-punitive kind of pricing.
Thank you. Any other questions?
Yeah, when you started, you mentioned 3 out of 10 get any communication and half of them actually view it. That, to me, for something that is so personal, sounds like a pretty low number. So why are we losing the 50% who do get any communication, and what do we need to do to get it to 80, 90, or much larger? What's
Jason, you want to?
Well, yeah, and I think Rita was teeing up the problem, and I think a lot of the collaboration that we're talking about today is the solution to go make those numbers better. And I think from our own experience, what we see is, for example, when we have this type of support structure in place and this type of education intervention going out to the patient, and it's coming from their care team and the patient knows that, we're seeing pretty good engagement. We're seeing 65% of the time the patient's going to pick that up, and some percent of the time, pretty high percent of the time, they're going to engage with it and have some follow-up action. So if it's personal, but it's also coming from someone that you respect and that is kind of creating an accountability for you as a patient to go do something about it, we're going to see much higher engagement, and that's what this opportunity is.
Agreed. Yeah,
I would also add on one thing from a doctor's perspective is, thank God our natural state, if we don't screw around and intervene all the time as physicians and varying kinds of clinicians, our natural state's wellness. Our body has a very strong ability to heal itself and just fix things. So we're not necessarily, I don't think that the driving number of what we should be looking at is, how many people in this room, by show of hands, have interacted with the healthcare portal. Because in reality, the vast majority of people in this room are young and healthy. They're not generally, unless it's a checkup or something, which isn't really going to dictate them needing to go and do that, is going to go and interact with the healthcare portal for fun. So there's a lot of other things that are more fun to do. So I think the more germane thing is, how many people have interacted and had a patient experience of some sort that needed to actually engage with this can do it, and what percentage are able to really do it and do it.
Right. Yeah, no, you make a very good point. I think that the point that I was trying to make earlier is that it's not a personal area for me. It's where my medical records happen to sit.
Yep.
It's not my go-to place to either learn about my health. So I think there's a place where I can search a very large database of curated information, but that I have no idea there was no prescription of these are the things that you should be focused on. And again, it's a login that's on my computer, it's not on my phone.
Yep.
And if I need to talk to someone and I'm sitting at work, then it means I've got to remember my chart login. I never remember that. And find the person that I need to communicate with, and I need to do it on my, I mean, there's just so many barriers, I call it friction, there's just a lot of
Tremendous,
friction
yeah.
to be able to deal with your
100%.
patient portal. It does not become a go-to place for
No, I
most
agree.
people.
Well, and as you started out, it's not just about the patient, it's about people the patients are caring for.
That's
So
right.
It's caregivers.
That's right.
And
Exactly.
that collaboration between the care team and the caregiver in support of the patient is an important part too.
That's right. That's
Just
right.
that database thing, if somebody has a thing that they want to query,
Yeah.
and they're actually getting something that's valuable, boy, is that potent.
It's potent. Yeah.
And actually could probably keep people out of engaging with the system, which
Exactly.
saves costs.
Yes.
So
Yes, exactly.
that's a big deal.
That's a big deal. Absolutely agree. Any other questions?
So my question is, where do you see the role of the payers, the insurance carriers changing in terms of patient engagement and communicating with patients? It seems like the direction we're going in is more of involvement from the payers in trying to help out with, say, prevention and wellness to essentially reduce the amount of claims they're going to have to pay
Yeah,
out.
absolutely.
Yeah, so, first, I don't feel too sorry for most insurance companies. So, these guys really are doing very, very well. However, they control the flow of money that goes into the system and how it's actually being allocated. So I do think there's a massive benefit from the insurance company's perspective to have a way for patients to be able to be triaged prior to actually entering the system. So if you've got a patient, so let's take my field, I'm a sports med specialist. My practice essentially was limited to 2 body parts, shoulder and knee. So practicing in Beverly Hills, California, see a lot of these weekend warriors. They're, an attorney, they go out and play, 5 sets of tennis on a Saturday. Monday morning, they're calling my office, I will need to see a shoulder specialist, my shoulder's sore. Well, that's absurd. They're gonna come to see a specialist, a tertiary specialist, and if they come there, they're gonna get an x-ray, they'll likely get some kind of a medication, they may be told to do exercise at home, or maybe even get a prescription for physical therapy, because they want to know that you actually did something for them. That's costly. So if they can go through some sort of like algorithmic thing through an insurance company, let's say that got them through, and that could even largely be automated until they actually get to either a nurse practitioner or some sort of family practitioner or internal. They could be sort of triaged in a way that's so much more effective. And there's tons and tons of things that go beyond that specific example that insurance companies will end up doling out a lot less money to be able to put their dollars into things that are far more effective for patient care.
So that's from a cost angle. Our business at Salesforce is to help our customers help their customers. And what we're hearing from our payers is, I need to be able to engage my patients and my members, right? And it's not just about me paying out claims. They have a bit of a bad reputation. They have a little bit of negative equity, if you will, with their customers right now. We've had, they have the fallout from when they weren't paying claims, they were denying people care, all that stuff. They've got to deal with all that stuff. Now they're saying they have to compete for people's business. You've got all these people that have entered the system because of Affordable Care Act. So all of these payers are now competing for those members, and they're competing for them to be engaged and not jump off because they can, because consumers now have a choice. So what we're hearing from our payers is that I need to be able to find other ways to engage my members, and I want to do it beyond just when I get the trigger of there's been an event on their claim, because that's the point when they don't necessarily trust me. I want to be able to engage them in other ways. So we're seeing lots of very interesting stories around members being engaged by payers, and they're investing in solutions with Salesforce across the board.
A comment. I was at a mirror group, and we had 2 million members about 5 years ago, and did a deal with SafeLink because getting cell phones into the hands of our members was really just a tremendous value, and so communicating with them, especially folks that don't have other means of communication. I mean, in Medicaid world, it's mail or nothing. I mean, telephones. We spent a lot of time making voice calls. But one of the questions I have is, with this pilot using the Health Cloud, how has that changed maybe or enhanced, I guess, your ability to target or, and I guess in the one-on-one world, it might not matter as much, but like for population, how does that change and how would that impact like the sort of stuff you guys would want to do to help people with population management?
Yeah.
I mean, was there any, learnings from using the Health Cloud in this pilot? Or was it really one-on-one interactions? You didn't work
Yeah.
with segmentation?
So it's fairly new,
Yeah.
and we really don't have like enough experience to for me to actually comment on that.
We can talk about hypotheticals. The product just went GA on Monday, so no
Right.
one could really access it except these guys. But
Yeah.
So you guys been doing one-on-one communication in the pilot stuff rather than any kind of population?
Yeah.
Right.
There's no question in my mind because I've already
worked great.
I've been living this world for the last 5 years with TigerText, and we started off basically being essentially a pure play messenger that was HIPAA compliant and secure. We very much have now, we barely even talk about compliance and that aspect of things because we consider that table stakes and that's just a checkbox for us. We've become far more focused on workflow and efficiency and taking these communication paths and allowing them to be able to be done in a way where it's low friction. There is so much friction in healthcare that it's crazy until you start really looking at it and answering it. So Health Cloud is so powerful because it goes across all of these silos and allows that massive amount of information to be accessed, worked with. And so it's all this structured data that's created that now can be worked with and communicated in an unstructured way through that kind of text or messaging. So even though it's early, there's no doubt in my mind this is going to be a game-changing solution, assuming it's executed, which I don't think is a company in the world that could probably have a better chance of executing on it than Salesforce. So I'm very excited about it and think it's going to make this a big deal.
So let me just add to that. I'll just extend, but it's game-changing from our perspective as well because this whole notion of team collaboration and then patient engagement, and both of those things happen in the same workflow application, that's a game changer. And I think there's a big battle looming for the primary workflow application for the healthcare industry. And Salesforce as a platform excels at combining that team collaboration with end-user engagement, that patient relationship management. So 8 years ago when we chose Salesforce, so I know this is going to work because of how we use Salesforce. So we're a population sales management structure. And we reach out to an identified population with our sales team, our marketing teams, and they all work together and collaborate, and they engage our clients. That's very transferable to this use case in healthcare. So that's why we're so excited.
Thank you.
So I was just wondering on the workflow side, does TigerText combined with the Health Cloud provide opportunity for, let's say the biggest, I think, patient burden is when somebody needs to get an appointment because they need to oftentimes figure out, what's the number to call up, wait on hold, get scheduled. Does it provide opportunity to, say, automate things like scheduling out an appointment over text message or something like that?
Absolutely, it does that. If a customer of ours wants to enable that function, where a patient wants to use their text messaging to be able to talk to a scheduler, for instance, maybe one of the people on their list of authorized people they can communicate with, absolutely, it can be facilitated. Can it be done from a technology? I think it'll be up to customers and say, I want patients to do this versus calling and please wait, someone will be with you in 30 seconds. There's probably a lot better ways to do it. So absolutely, it can be done.
There's going to be a lot of learning once it starts getting deployed from actually using it, and
Yes.
it's good. It's a fluid process, but you got to start somewhere, and they've really done an amazing job with this so far.
Thank you so much. There's one more question and then
Rita, I love what you guys are doing. I'm just so we have a Cedar Sinai world-class health system. Dr. Hughes at work there. What's your approach to be able to talk about the value proposition, get them to recognize the opportunity? Really
Yeah.
curious about
Yeah, no,
your strategy.
thank you for that question. I think the thing is that I always like to give some people some background. We didn't sort of wake up as an organization one day and say, we really should move into this space because it really is very interesting. we did it as we do everything, which is we heard our customers. And our customers said, listen, I've invested lots of money, millions of dollars in all these systems, and but I can't do this thing where I need to do a lot of coordination around a patient, whether it's discharge planning, whether it's onboarding a patient. We heard from our life science customers, they need to be able to engage to make sure that people stay on their therapies. We can't do that with our existing systems. So you guys do this collaboration and communication thing very well. What can you do for healthcare? What can you do to help this piece of what needs to happen in healthcare better? And the other thing is that patient engagement was never really, I've worked in healthcare for 16 years. Patient engagement was a nice to have. Now we have to have it, right? That patient comes back within 30 days. There's $468 million in penalties that were paid in 2014. No one wants that. So our value proposition when we go into provider organizations is where do you have problems where you need to have a high level of coordination for patients so that it will drive better outcomes for you and better patient satisfaction for you. That's our message with providers. Life sciences, it's how do you need to keep patients on their therapies. It's not enough just for that script to be written. You've got to engage, and they are. Life science companies are coming out in droves and saying, I want to engage the patient. Is that helpful?
Yeah, that's spot on what she says about like readmissions. One of our customers, Scottsdale Health Partners, it's an ACO in Arizona, obviously. They won an award here last night for Innovator of the Year because around one thing that they started doing with coordination around discharge, they cut their readmissions rate by 60%. So just communication, massive thing, and it's not. This isn't theory. This is basically about execution of something that we already know exists. So.
That's right. Well, thank you so much. Thank you to Jason and Andrew for being here. And this was